rest of everybody's, a peaceful class, we'll just mute everyone. And then whenever you want to discuss anything, probably what you can do is we can put in the chat section. And then once we complete the session, then we can take all the questions and go ahead with it. Okay, sounds good. Let's begin. Okay, so first of all, would like to know from your end, what do you understand by delegation? It's from the word itself, you can understand something, right? You have a basic understanding of delegation. So what is delegation? Okay, so delegation is nothing but that you are transferring some of your responsibilities or some of your tasks to some people who are, who are eligible, who are trained to do or conduct those tasks on your behalf, but the responsibility or accountability of that particular task is upon you still. Okay, now why do we delegate? So it is a human nature that you want to do all things by yourself, but sometimes what happens is when you want to do all the things by yourself, you may end up being completely burnt out. So hence, in the hospital or in a healthcare facility, there's a team of people who can assist you in the daily patient activities, right? But as a registered nurse, you need to understand what is their scope of practice, what is your scope of practice as a registered nurse, what you can delegate safely, what you cannot delegate safely. Okay, and delegation basically comes under a big topic called management of care for your Nclex Rn examination. Okay, I'm sure that you all have seen this graph when you're preparing for your Nclex Rn exam. So it basically tells you that as per the Nclex Rn test plan, what all is that you are supposed to revise and review, and what is the percentage of questions you may get, you may get that is required for you to revise for your actual examination. So you all know that in Nclex Rn test plan, it is clearly mentioned what all are the domains where you are tested, like management of care, safety and infection control, basic care and comfort, then reduction of risk potential, physiological adaptation. And each of these domains has a certain percentage of questions that comes into your exam. Okay, so today we are going to deal an important topic which comes under your management at 20%. And from my experience, I can tell you that this domain is so important that sometimes many of our students have told me that after their NCLEX exam, they felt that the whole exam was management of care. Okay, so under your management of care, these are basically the topics that that you should revise and review. Okay, so there is advanced directives and advocacy. You must know how to assign tasks or delegate tasks, what we are going to learn today, supervise. Then as a registered nurse, you are not only delivering the nursing care, but you are also managing the case, so case management, ethical and legal aspects, prioritization. Also, are you able to do your referrals properly, and are you able to maintain the continuity of care appropriately, quality improvement, and information technology, whether you're able to have a basic understanding of these things. Okay, so under your management of care, which accounts for your 20% of your questions in your NCLEX exam, these are the topics that you must revise for your management of care. Okay, so this is not something that I have devised. What I tell all the students is, please refer to the NCLEX test plan, and you will get all this information there. It clearly breaks down under each domain what is it that you are expected to know. Okay, all good till now? Any questions till now? If all good, can you please type in the chat section that you have understood till now what I want to tell you? Okay. Okay. Okay, perfect. So can we go ahead? Okay, excellent. Okay, so as we were discussing when we started session, delegation is nothing but transferring of some of the performance of nursing task to an individual who is competent to do it. Okay, you just do not delegate any task to anyone. You need to measure the outcome. You need to be able to understand whether that task the person is, you're delegating, the person is competent to do it, And you also have to communicate to them that once they complete the task, what is it that you are expecting them to do? Do you want them to come and tell you? Do you want them to document? So all those important things you must consider when delegating in any kind of task. Most important thing, as a registered nurse, you may delegate the task to someone, but the accountability or the responsibility of that particular task still remains onto you. Okay, so you must be very, very careful of what you're delegating, how you're delegating. Okay, before we move ahead, we'll review some of the healthcare roles. You must have seen all these terminologies in your examination, or if you have taken a previous examination or while you're studying. So you get a very common term, primary healthcare provider, or a specialist who's diagnosing and treating the diseases. Then you have other roles like social worker, your physiotherapist, physical therapist, occupational therapist. Then for the spiritual needs of the patient, there's a chaplain, nutritionist, pharmacist. So in under management of care, again, it is important for you to know correlation between all these interdisciplinary healthcare team members and how this role that is important for you to. So okay, so are you still with me? Are you able to hear me clearly yet? Okay, I think so. Yes, can you all hear me yet? I think we had a disturbance in the network. Okay, no problem. Okay, so now let's move on to what is the nurse's role. So nurse's role is not only to promote and promote health, prevent disease. You are a patient advocate. You are making some critical decisions in important times. You're leading and managing the team. You work as a case manager, so you correlate between other healthcare team members. You coordinate the task so that the patient is able to get the best of nursing care and best of patient care in the hospital. You act as a resource person, you act as an educator. So I know that from the different backgrounds we all have come in, we had a different perception of how the nursing personnel works in the hospital. But for your NCLEX exam, what you need to know is that what is your healthcare role is very different. It's pretty different. So what you have assumed in your previous work, you have to kind of dissociate yourself from that, and you have to put in these new shoes wherein you are supposed to work as a case manager, you're supposed to work as a client advocate, you're supposed to work as an educator, you're supposed to work as a resource person. So it's a kind of a very comprehensive role that nurses play here in healthcare system in Western world, Australia, etc. Okay. So coming to, again, very important, 5 rights of delegation. Okay. So the 5 rights of delegation are: right task, first of all, that whatever task you are delegating is the task is appropriate to the person to whom you're delegating it. Then are you delegating the task in the right circumstance? So for example, normally your unlicensed assistive personnel can assist in activities of daily living. But is your patient in a stable condition that he or she can be delegated to that particular staff? You need to judge that. So it's just not a standard rule. Okay, you delegate this task to this person. You have to judge what is the condition of my patient. Is he stable enough? Are there any risk factors in terms of his health if I delegate this task to this person? So you need to evaluate the circumstances and the environmental situation at that time before you delegate. Okay. Then right person. So as we discuss in definition itself, is the person competent to do that task for you? Does he has the level of understanding, knowledge, and attitude to do the task appropriately? So the right person is very, very important. Okay. Then are you able to supervise that person properly? You're giving him the right directions, right communication. Are you telling him clearly what is it that he has to do after the completion of the task, what he has to report to you? Or when do you want him to report? How do you want him to document? All these directions you need to give. then only you are able to delegate or assign particular task to a person appropriately. Okay, so again, it's a common question for your Nclex. So you can get a multiple choice question here about the 5 rights of delegation. Okay, clear till now? Any questions you can type in the chat section, or all good till now? Okay. Okay. Okay, then moving to the principles of delegation. Okay, so when you delegate, just don't think that, I'm going to delegate this task to a person and that's it. No, you have to think the outcome. You have to think of the result, end result you need to have in your mind when you delegate any particular task. Okay, then you delegate a task, you need to delegate it completely. Don't just delegate bits and pieces of it. Okay, so something that you don't like, you delegate. No, when you delegate the task, you need to give them proper directions, proper communication, and you delegate that particular task completely to that person. Okay, then allow participation in the delegation of assignment. Why it is important that when you delegate, it's just not, you have to understand whether that person has the right attitude to do it, right skill. So a participation from that person will help you in better delegation. They will be able to tell you that, okay, these are my skill sets, I'm good with this, I'm not good with this, and hence you can delegate appropriate tasks to appropriate people. So participation is extremely important. You have to establish authority, you have to establish responsibility, and you have to make them understand what is the outcome, and you have to make them work within the organizational structure. So whatever responsibilities uh, are appropriate to be delegated as per your organization rules, their policies and procedures, you have to follow them. And each person in the hospital has their own scope of practice, which matches with what the organization says, and you have to refer to your organizational policies to identify and delegate tasks appropriately. Okay, then of course, when you delegate any task, you have to you just can't delegate and then uh, dissociate yourself from it. You have to provide adequate support to that person for the completion of that task, evaluate it properly, and assist him to grow and improve his skills. So you have to, of course, provide adequate support to the person to whom you are delegating the task. Okay, I hope I'm clear till now. Any questions before we proceed? Okay, I hope no questions. Please type in your questions, okay, in the comment section. Then after the session, we'll be doing some Nclex questions as well. Okay. Okay, so now, very, very common thing when you delegate, sometimes you will have some problems. Sometimes some problems might be associated to your attitude as well. Okay, so sometimes what happens is that you tend to over delegate. So when you are so busy, you think, you don't put your mind and soul and, your brain in assessing and following the rights of delegation, principles of delegation, because of your poor time management. Okay, so then you sometimes over delegate things. You will not put your thought process in delegating the task appropriately. Then sometimes as we all have gone through that stage where we think, okay, you delegated something to someone, the result was poor, so you always have this in mind, okay, why do I delegate? Let me just finish everything by my own. So you have a lack of confidence in the individual. And just a second. Okay, then the other thing is that sometimes what happens is the person to whom you're delegating the task does not have the, just a second, my charger is does not have the necessary skills to do it. Okay, so you need to understand that sometimes absence of the necessary skills can be very, very dangerous. So you need to understand that when you're delegating any tasks, the person has the right skills to do it. Okay, then sometimes what happens is you under delegate. So you have a lack of trust with the person. You have a fear that if I delegate these tasks to them, what will they think? What will they think? Will they think that I am trying to just push my responsibilities to them? Then sometimes you think, okay, let me do all the tasks by myself so that I can gain the maximum amount of experience. But you have to understand, when you do that, you also tend to take yourself on a verge of burnout. So you want to gain the experience, but and personal satisfaction, but you have to accept, or everybody has to accept, that you cannot just do everything. So you need to delegate tasks appropriately. Okay, now I would like all of you to note this slide down properly. So these are specific terminologies that you must know for your NCLEX exam. So you will get questions in delegation, and you will see these terminologies. These terminologies are not very common in Australian healthcare system. So there is a category of personnel called UAP, unlicensed assistive personnel, and you can get questions in your NCLEX exam where you are asked to list down some procedures are there, what all you can safely delegate to a UAP or an unlicensed assistive personnel. Okay, very much like a caregiver or carer. So golden rule: the unlicensed assistive personnel are basically, the people who will help in terms of activities of daily living. So they can do all kind of non-invasive tasks, basic patient care activities, positioning, ambulation. They can collect the specimen. They can help the patient being transport, grooming, personal hygiene and care. They can assist in some kind of housekeeping, stocking, and assist with all kind of activities of daily living and maintenance activities. Okay, so any kind of non-invasive task and patient care can be done by a unlicensed assistive personnel. Okay, so have you all written down this slide? Okay, so UAP, or unlicensed assistive personnel, important terminology for you to remember. Again, I'm reviewing it. Any kind of non-invasive task and basic patient care activities, your unlicensed assistive personnel can do. Okay. Then we move to the next terminology that you must know: LPN, or licensed practical nurse. Now, licensed practical nurse, since these terminologies are from the NCS1. Okay, so I think Sukirti say examples of UAP. I mean, who are UAP? So UAP is basically any person who is kind of a who does not have any license to practice, but is what I can, I won't say they're completely 100% similar, but if you're in Australian healthcare system setting, then somebody like an AIN or assistant in nursing is something very similar to UAP. But for your examination point of view, you need to understand the terminology UAP and licensed practical nurse. The difference between the two: UAP is an unlicensed professional. They are not licensed or to work. It's not a licensed profession. Whereas your LPN is a licensed professional. They have done a program, they have done a training, and then now they are licensed to practice under the scope of what they can do. Okay, I hope, Sukirti, I'm clear. Okay, now under your LPN, licensed practical nurses, again, it is a US terminology, but for now as well, NCLEX examination in Australia still uses these terminology, so you need to know. Okay, and you want to know more about the scope of practice. What I would advise you is to go to the NCSBN test plan and detail it in there. And for now, if you have this basic understanding of what is a UAP that a UAP can do and what is it that a LPN can do, this will help you in your delegation questions. Okay, now for your LPNs, or licensed practical nurses, what they can do, they can record take and record the vital signs, chart the medical records. They can administer most of the medications except IV medications. Okay, they can change the wound dressing, collect specimens, insert and care for urinary catheters. They can, you can give a little complicated patients to them, like ventilator patients or patients with who have tracheostomy tubes, ostomy care, and they can help you in monitoring patients. They can assist in emergency CPR and also execute the nursing care plan, which is formulated by a registered nurse. Okay, so LPNs can do a lot of things, and this is kind of, you have to memorize the scope of practice of an UAP and LPN so that you can do the questions in your exam appropriately. Okay, so as I said, they can administer most of the medications except IV, intravenous, and they can do your vital signs, chart medical records, and do all kind of routine care. So your ostomy care, tracheostomy patients they can handle, ventilator patients they can handle, but you have to remember, which I'm going to tell you in the next slide, that an acronym for, as a registered nurse, and golden rule that you need to understand is that you do not delegate what you eat. Okay. So anything that is related to evaluation of a patient, assessment of a patient, and teaching, you cannot delegate. Okay. That lies to you only. And you have to you should not delegate what you eat. Okay. Now, so and also as registered nurses, you get the most critical patients, and LPNs get stable patients. So any kind of critical patients that you will have in your practice, you are the person, you should be in charge of them, because they are unexpected. Their outcomes can be unexpected, the situations can worsen, and you are the only person on the floor to who is competent to handle such kind of emergencies. Stable patients, you can delegate to your LPNs. So again, do not delegate what you eat. Evaluate, assess, and teach. Okay. So any kind of health education, teaching, you are responsible to do it. Whereas if you are asking an LPN or an AIN to reinforce the teaching, they can do it. So you have taught, you have explained, they can remind the patient, but you are responsible for teaching the patient. Are you able to understand the difference?
Yes.
Okay.
Clear.
Good. Okay. Now, as a registered nurse, now what all you can do, you can do all the activities that an LPN can do. You can administer all type of medications, including IV. You can perform BLS, ACLS, PALS. If you are certified, you adds to your competency. You can manage all types of wound care, insert catheters, intravenous, intrauretral. Most important, you are the person who is assessing the patient, developing the plan of care, responsible for execution, responsible for evaluation. And then when you evaluate, what do? After your evaluation, you replan and then modify the nursing care plan based upon how your patient has done, based upon the previous plan. Correct? Yeah. Then you can admit and discharge patients, accurate documentation, safely transfer in patient out of the bed and chair. You are able to feed, dress, any kind of hygiene activities you can do, supervise LPNs and AINs, and ensure that overall safety is your responsibility. So you are responsible for the safety of the patient. Okay. Any questions about the scope of practice of an LPN, registered nurse, or a UAP? And any question about this golden rule, eat. You do not delegate what you eat. Please feel free to type in the questions in the chat section. Okay. So no questions. Okay. Okay. So this is what, kind of the summary of delegation is. And so let's try and practice, few questions to see whether you're able to, you're able to solve some of the questions on delegation. Okay. So the first question is, there's a guy called Stephen. He's a nurse preceptor who's working with a new nurse, Joe. He notes that the Joe is reluctant to delegate any kind of task to members of the healthcare team. He recognizes that this reluctance is most likely due to role modeling behavior of the preceptor, philosophy of the new nurses school of nursing, orientation provided to the new nurse, or lack of trust to the members of the healthcare team. Okay, so Joe is very reluctant to delegate any kind of task to other people. What do you think his issue is? Is he confident? Whether he is, what is going on in his mind? Does he have the enough trust to delegate?
No, the lack of trust to the member of the healthcare team. That
Yes.
is making him to like reluctant to delegate the task to the member of the healthcare.
That's right. Absolutely. So you can see that, he does not want to,
Uh, Delegate.
because he has a lack of trust. Okay. Good, Mamta. Very good. Okay. So what task, next question, what task would be appropriate for a nurse caring for a client diagnosed with GERD to delegate to an UAP, unlicensed assistive personnel? Okay. So inform the client of the need to avoid irritants such as carbonated beverages. Remind the client to avoid tight-fitting clothes. Monitor for GI upset 30 minutes after meals, or ask client if they are eating small and frequent meals. Okay, so now think of what a UAP can do, and then evaluate what is the best thing that the UAP can be delegated with.
Reminding the client to avoid the tight fitting clothes.
Okay, anybody else would like to try? Why do you say reminding, Mamta?
Because nurse responsibility is to inform, monitor, and ask the client. It is like just she is on license, so she can just remind the patient that
Good. So you're right. So you remember what we learned, that when you can't do teaching, they can't do
yeah,
teaching, you
yeah,
teach, but they
mm-hmm,
can reinforce the teaching. So you can
yeah,
remind the client to
yeah,
avoid any tight-fitting clothes, but they cannot monitoring. Monitoring is very much like your evaluation, okay? Or or you're having a continuous evaluation. Informing is again teaching, asking is assessment. So you cannot ask them to do that. Reminding, yes, they can reinforce the teaching. Okay, so the correct answer is B. Very good. Okay. Okay, the next question. Nurse Andrew is working on the afternoon shift with the UAP, unlicensed assistive personnel. The UAP comes to the nurse stating that the other nurse working on the unit is not assessing a client with back pain despite multiple requests. So the UAP is kind of, telling the afternoon shift nurse that, there is a patient who is having back pain. The person has, he has requested the nurse to go and assess the patient, but the nurse is not doing it. So which of the following action by the nurse is best? Okay, so ask the other nurse if she needs help, assess the client and let the other nurse know what should be done, contact the nursing supervisor to address the situation, or ask the client if he is satisfied with the care.
contact the nursing supervisor to address the situation.
Good. Anybody else? Has anybody any other options that you think are right?
Ask the client if he is satisfied with his care.
Okay, so now you have to think like this when you answer the question, that you should be able to one, that you see that the person is having back pain. He has the UAP has gone to the nurse again with multiple requests, has not has not attended to the needs of the patient. So there is a problem there. So first is problem resolution. Okay, so you have to immediately go and contact the nursing supervisor, because the other options, like whether you go to the nurse and asking her that whether she needs help does not resolve the problem you want. There you see that there is some behavioral issue there, so you have to contact the nursing supervisor, because that is a right channel of communication and the person has not responded after multiple requests. So you have to contact the nursing supervisor to address the situation promptly for the department. Okay, clear to everyone?
Yes.
Okay, we are in the fourth question. Okay, so which clients are appropriate for the charge nurse to assign to a licensed practical nurse on a medical unit? LPN on a medical unit. This is a SATA question. So there are multiple answers. Okay, select all that apply. So the first option is client with a colostomy whose appliance is leaking, client with a serum potassium level of 2.8 MEQ per L, the client with a seizure history who's receiving gabapentin, client who needs elastic compression stockings applied, client with moderate low back pain who's restless, or client with diabetes mellitus whose due dose of insulin. So select all that apply. There are multiple answers which are correct. Please type in your answers in the chat section. And if you are not speaking, would request you to mute. Type in your answers, please, in the chat section. Okay. D. Anna also says D. So, okay. So because it's an elastic compression stocking, you're saying that they can put. Then I can see some C as well, E as well, because, oh, E. Okay. Okay. So some of you are saying E also is a correct answer. Okay. Okay, let's see what are the correct answers. So the answers are A, C, D, and F. Okay. So first of all, A, let's go by A. So a client with a colostomy whose appliance is leaking, remember when we learned about the scope of practice of an LPN, routine ostomy care can be performed. So A definitely can be delegated to an LPN. Okay. Why we cannot delegate B? I think most of you are right here because potassium level is very, very low. The person has hypokalemia. There can be complications. The person can go have arrhythmia. So we don't delegate. There is a chance that this person may go into some kind of complications. We don't delegate that. We will keep that for a registered nurse. Seizure history, who's receiving gabapentin. Okay, so it's a routine kind of a medication. There's no indication in the option that the person is unstable or anything. So that can be done by an LPN. Then D, of course, needs an elastic compression stocking can be given to an LPN. Now, why E is not the correct answer is that the person has a low back pain and who is restless. So you have to, identify the terminology here, restless. So
It's unstable.
so the person is kind of unstable, I won't say unstable, but very, very restless, and then requires evaluation, right? You cannot just leave the person. You have to evaluate the reason behind his pain and restlessness. So who evaluates? The registered nurse has to evaluate. Okay. And then if there's a client who needs a dose of insulin, that can be safely allocated to a licensed practical nurse. Clear to all of you? Yes.
Yes.
The beauty of SATA questions, or the beauty, or you can say the evilness of SATA question is that even if you answer even one option is incorrect, your whole question is marked as incorrect. So if you have, if let's say from the 4 options you have answered 3 correctly, but one of your option is incorrect, unfortunately NCSBN marks it as an incorrect answer. Okay, so yeah, you need to really, really practice a lot to get the right, answers in a SATA question. Okay, I think this is the last question of the day for today. So let's see, what is the question? So the nurse is considered professionally negligent by delegating which task to the unlicensed assistive personnel. So you have to identify that if the nurse delegates which all tasks, if the nurse delegates to a UAP, the nurse can be liable for negligence. Okay, so measuring a client's temperature rectally, administering eye drops stored in the client's room, increasing a client's intravenous fluid flow rate, insert a straight intermittent urinary catheter, changing a peripheral intravenous site dressing. Okay. Okay, anybody would like to try and put in the chat section? What are your answers? Okay, I'm not sure whether I mentioned this to you in the scope of practice in UAP. So a UAPs also can take the vital signs. Okay, they can take the vital signs, they can document it as well, but you have to clearly remember that right circumstance. So never, you cannot delegate unstable client to a UAP and ask them to document and monitor, assess the vital and document the vital signs. For an unstable client, you cannot do. For if for example in a aged care facility wherein there's no it's a regular routine care that a person is not having any kind of unexpected outcomes that you're expecting is stable, then you can ask UAPs to do the vital signs as well. Okay. Okay, so I can see C, D, E. Okay. So, okay, good. So first of all, let's see what's the answer. Oh, there was another option. Sorry about that. Okay.
Right. But when you look at this client, that's a little like a 3-by.
Okay, check yourself. I think this.
Pretty.
So, okay, so let's see the answers. The answers are B, C, D, and E. So first of all, can the UAP administer any kind of medication? No. Okay. Even if it is over the counter or whatever, no medications can be administered by UAP. So if the nurse allocates B, she can be liable for negligence. Okay. Same is with C. You cannot ask the UAP to increase, decrease, or do anything with the intravenous infusion flow rate. Okay. Then they cannot insert a catheter. You require an understanding of asepsis and infection control. They don't have it. They can't do it. Okay. And then they cannot change any kind of IV dressing. Tap water enema, they can administer. It comes under kind of, a comfort care. So they can do that. But then intravenous side dressing also, they cannot do it because again, you need understanding about the asepsis and infection control, which your UAP does not have. So if the nurse administers B, C, D, and E, she can be held responsible for negligence and has to suffer consequences for it. Okay. So I hope you all have understood kind of the gist of delegation and nothing but delegating appropriate tasks to appropriate people, ensuring that good communication is maintained. You are supervising them. You know, most importantly, the scope of practice of each person. And then, you are delegating the tasks which are uh, right for the right people. Okay. So that's a little bit about delegation. And any questions about the topic? I would love to take any questions. If you have, you can put them in the chat section. And just wanted to let all of you know, because we have limited time, we can't do the whole management of care, but I think we have covered in our live sessions prioritization, ethical and legal aspects as well, and now delegation. So if you haven't seen those other videos, it may be useful for you. You can go to our Facebook page and look out for the videos of ethical and legal aspects as well as prioritization. And if you are interested in doing the structured training program with us, so we offer an 8 weeks training program wherein you are trained every day, Monday to Friday. We offer 5 days classes, and the management of care usually takes 1 week. So, and delegation is a very major component. So we do almost 40, 50 questions every day. So, it is quite challenging to summarize a big topic like delegation in a 1-hour session. But yes, it is very important for you to know these concepts for your Nclex exam. Okay. And we are starting our new batch on 22nd March. The orientation of that batch is next Friday, 1 week from now, 19th of March. And we have the last 3 seats. So if you are interested in joining us for a structured training program, as I said, 8 weeks every day, Monday to Friday, 2 to 6 p.m. Sydney time classes, we are happy to have you on board with us. Okay. All the classes are recorded. So even if you miss the class on any day, you can always go back and look at the class later. But of course, we encourage you to attend the class every day if possible. If not, 1 or 2 days you're working or you're skipping the class, you are all our adult learners. You can go back and look at the recorded session, come back with your doubts. Our faculty is happy to help you. You do every weekend, you do assessments. You do a primary assessment when you start your training. Then every weekend you do the assessments of whatever you have learned between your Monday to Friday. And then at the end of the training program, you do our predictor exams. After your predictor exams, you basically, get a one-on-one coaching session with our faculty who will tell you, okay, in these domains, you are good. These domains, you are near the passing standard. These domains, you are below the passing standard. They will give you a test plan and, basically, bring your focus towards the areas where you need improvement. And also we provide you 3 full-length mock exams, which are computer adaptive in nature and gives you the real feel of an actual Nclex exam. So all in all, it's a very, very well-structured training program, and we have received very good response. All our faculties are US and Australian registered nurses who have cleared Nclex themselves. Those who are who are US registered nurses have been training Nclex students to go to US and Canada. So they come with a huge amount of experience of how to train nurses for the Nclex examination. Okay. So, and if you have any kind of questions about the program or you need any assistance, you have my number. I've dropped my number in the chat section. Also, you can call me on this number as well, 478-860-673. And let me know if you have any questions. If you know somebody who is looking for an OSCE training, So ours is the only training across Australia, which is 5 weeks on campus. In fact, I am at our OSCE simulation lab, and we have our OSCEs going outside. And our 5 weeks program is completely on campus, Monday to Friday, 5 weeks, 5 days. You do the OSCE, you do the mock exams and skills and practice with our OSCE educator, Lillian, who has been training bridging program students for the many years.